So without further ado, I'm going to turn it over to Christine Taylor. Christine is a registered social worker with a Master of Social Work from Wilfrid Laurier University. She's worked on the front lines with victims of intimate partner violence for 13 years and is currently the program manager of the Sexual Assault and Domestic Violence Treatment Center of Waterloo Region at St. Mary's Hospital. And if you want to know more about Christine, you can check the website as well, where we have more detailed information. So Christine, I'm going to turn it over to you. Thank you for being here tonight.
Okay, you're welcome. Thanks for that introduction, Rob. Okay, so good evening, everyone. Thanks for joining us. I wanted to just start out by sharing a little bit about our team at St. Mary's and what we're about and what we do, just briefly. So the Sexual Assault Domestic Violence team at St. Mary's is a team of nurses and social workers who respond 24/7 to cases of sexual assault, intimate partner violence, and human trafficking at St. Mary's Hospital and Cambridge Hospital. So when people present to emerge in that situation, our team arrives within 45 minutes and offers a number of care options, including crisis support, medical options, forensic evidence collection, and many other options that people can choose from. And at that point, because we're lucky enough to be the only center of 37 in Ontario where both a social worker and nurse present to emerge, that social worker who met you that day offers follow-up counseling for you if you want it. So you're immediately connected and follows you through your healing journey from there. People can also be referred through our office if they've had that experience within the last year, and they will be matched with a counselor who can see them around their intimate partner violence, sexual assault, or human trafficking experience. So we have both a hospital part of our program and then also the community-based program, and we're part of the Family Violence Project, which you'll hear more about in this program, but essentially a whole group of co-located services, one-stop service access for intimate partner violence. So that's very nice for victims and service providers helping us work together. So I wanted to just really talk about intimate partner violence in 2023, because I think for us, we often notice a real misconception in the community that intimate partner violence perhaps is, a quiet, private thing happening behind closed doors where women are, predominantly women, but of course people of all genders face intimate partner violence, are coming in with minor injuries and, are easily treated and off they go. We have to tell you that in 2023, we are seeing a really alarming number of cases where people are presenting to emerge with very serious injuries. So 15, 20 years ago, to have a case where somebody was forcibly confined or strangled, where there was sexual exploitation or assault with a weapon, something of this nature, was fairly novel or uncommon, somewhat unusual. And unfortunately, those cases are ones we are routinely seeing in the emergency department these days. And Waterloo Region is not alone with that. I was just at a meeting of the 37 managers across Ontario, and across Ontario, we're called SAT teams, are seeing these really significant injuries and a lot of very violent intimate partner violence cases coming into the emergency department. We've really noticed this in particular since COVID, post-COVID in the past 1 to 2 years ago, 1 to 2 years, this increase. And I think it also speaks to the number of women who are dying at the hand of their intimate partner at the hands of their intimate partner. That's something that Jen Hutton is going to speak more about later in the program. But These kinds of serious injuries, debilitating injuries, are really, unfortunately, something we're seeing routinely now, and that's relatively new. The other thing I wanted to mention is that, and I'm, in a way, I apologize for having to be so detailed and graphic at the outset of this evening, and I don't do it to be provocative or alarmist, but I think people need to understand the truth of what we're seeing in terms of intensity and levels of violence in hospital in order to really be taking this social issue as seriously as we need to be. The other thing that I wanted to talk about the debilitating piece. So, when advocates say that intimate partner violence is now a public health crisis, I think, it's absolutely true. We are dealing with situations where women are facing really debilitating injury, long-lasting debilitating injuries as a result of the assaults that they're dealing with. And within the past 6 to 8 months, I can think of cases where women have dealt with stroke as a result of strangulation, amputation as a result of not being able to access medical care in their abusive relationship, facial disfigurement. It has just become an absolute health crisis from our perspective, and it's not when as Jen will say later on in the program, when you look at the number of women, the femicide numbers, these incidents are consistent with that and what we're seeing across the province that way. Fortunately, we're at the point where 71 municipalities have declared intimate partner violence an epidemic, which is wonderful. And, it's only as a result of the hard work of local communities advocating and pushing this agenda forward. So the other piece I just wanted to talk about is youth dating and intimate partner violence. I think we need to recognize that intimate partner violence is happening across the lifespan. Youth are presenting to hospital as early as age 13. We have clients age 13, 14 coming in as a result of violence in their relationships. And we're dealing with the complexities. Youth are dealing with the complexities of things like online harassment, online stalking, sharing sexualized photos, dynamics of sexual exploitation through relationships they've created online or that have started online. So these are all the kind of different dynamics and dimensions of intimate partner violence that youth are experiencing online and in person. And, I think the time has already passed, but the time is now to really start to engage youth around intimate partner violence, invite them to be taking a position on this issue and to bring them into the movement against it, because, these are our future people, and they're already experiencing and dealing with these issues now in their dating relationships. So I can't stress the importance of early intervention and having these conversations with our youth now.
So, Christine, I just want to jump in for a second there, because there's so much there I'd want to unpack, and we could probably talk for a whole long period of time. Yeah. First thing that was coming to my mind was that you're a violence treatment center, and somebody comes in with physical injuries or psychological injuries, and it's a result of domestic violence. You're there to treat them, and what do you do about the relationship? Like, people go to the hospital, get fixed, go back home, but this is.
Well, yeah, I mean, people present all along the continuum, right? So some people come in having left their partner, and this is continuing to happen in the post-separation period or post-breakup period. People come in and then wish to return to that abusive situation, which of course is a conversation and ultimately their choice. People come in when there often after a situation where there's been injuries, often police have been involved, whether the person's called or a neighbor's called or so on, and then there's a no contact term in place, so it's not immediately that person is then prohibited from having contact with the abusive partner, and sometimes they're ready for that and sometimes they're not. So that's another conversation. When that happens, the rug of your life is essentially pulled out from under you, as you're now grappling with the new reality, whether you were ready for it or not, as I said. So so that's it. I mean, exiting an abusive relationship is a process. It's a journey. It takes many times often for somebody to decide to leave, and people are at different stages. And like I said, even post-separation, many women, people of all genders, deal with, especially when there's children involved, continued IPV through access to children, or just from a partner who continues to stalk them and carry out their campaign even when the relationship is over. So
yeah. The other thing that's just coming to my mind is, okay, someone comes in and there's an assault. I guess, we've got Staff Sergeant Hatchborn here to talk about from the Waterloo Regional Police Services perspective. I'm imagining that there's interconnections with all of these different groups that we have here with us today in terms of referrals or contacts. Or the other thing that's just coming to my mind is, okay, someone comes in and there's an assault, I guess.
Well, that's it, Rob. So many of us, at least probably half of us here are part of the Family Violence Project, which are co-located services for intimate partner violence. So with the right consents in place, we walk down the hall and can chat with each other, share cases, pull in each other's resources and services where we need to, because we all play a part. Yeah. Well, that's
and it's interesting. The other aspect that we often don't think about is youth and social media, young teens and what they're going through. And obviously, then that's more a mental health issue, no doubt, I guess, or there's self-harm issues there. So just briefly, can you just touch on that for a second? Yeah, and it's interesting. The other aspect that we often don't think about.
Well, I wouldn't say mental health or self-harm are necessarily elements. I mean, youth are trained up in the culture that they're trained up in to take on these sort of norms around toxic masculinity and what they're entitled to in relationships, and these dynamics play out in youth relationships the same way they do in adult relationships. And sometimes mental health is a piece of it, and certainly the survivor needs, or the victim needs, however you want to word it, needs that often will need mental health or emotional health support in follow-up. But with youth, there's a lot of different complexities at play.
Okay, Christina, thanks a lot, Christine, for that.